Thank you, Oreta. Thank you so much. Good morning. Buenos dias. My name is Tatiana Allen-Webb, and I'm the Program Manager for the Utah Area Health Education Center, also known as Utah AHEC. May I take a minute, please, to praise Kevin, as he is one of our participants in our AHEC Scholars Program. And I'm feeling right now like a proud mom. And you did great. Thank you so much. All right. The goal of the Utah AHEC Health Education Center is to provide access to primary health care for Utah's entire population. We focus on recruiting and supporting Utah primary care force, which in turn increases the capacity of our health system and improves the health in communities throughout the state. There are communities throughout Utah that face significant shortages in their primary care workforce, especially those in underserved urban areas of the Wasatch Front and the rural areas across the state of Utah, sorry. The Utah AHEC works to address these challenges by preparing a diverse workforce of health professionals for practice in medically underserved rural and urban areas. All right. So where I was going is explaining what AHEC does. We do medical professions. We train them. We hope they become everything that Kevin represented today. Passionate students, compassionate students that go out and practice. All right, so community health workers are uniquely suited to bridge the gap between services and need for care for these diverse groups in Utah. Coming from the communities they serve, community health workers are bringing a deep understanding both of the cultural needs affecting health in these communities. CHWs can help access care while also helping caregivers provide culturally competent health services with humility and respect. The Utah AHEC is so proud to have engaged a community health work team to teach curriculum to medical profession students from across the state of Utah. These students range from medical doctors, social workers, nurses, occupational therapists, masters in public health, masters in health administration, dental hygienists, dentists, and others, as well as practicing clinicians. The CHW team will provide culturally sensitive, high-quality telehealth care for members of underserved urban and rural communities in Utah. It is an honor to introduce you to the amazing Community Health Work COVID-19 team with AHEC.
I came here 24 years ago. When I came here, I didn't know what to do, right? I left everything back home. My friends, my career, my family, everything. And I feel out of place here. Like, I don't know what I'm going to do. And then close to my house, there was a Head Start program. And I remember I would like to go outside and walk because my husband works, but I stay at home, right? Mm-hmm. And yeah, you know, when I started in that program, I started noticing a lot of needs. It's not just in Head Start, but in other areas as well, right? And what I noticed, it was like people telling me what is going on, and I have a voice to represent them. And I like that part because there has to be someone there. And 24 years ago, the community, the Hispanic community was very small, and not many organizations or people were working around. We have to be the pioneers in that area where we could go in and talk and do advocacy. You know, that word, it was new for me as well. When I knew what advocacy was, oh my goodness, that was so amazing. And I volunteered like 15 years probably until I have like an opportunity to work for an organization. And I said, yeah, you're gonna pay me for the things that I do? That's amazing, right? Because the things that you love and now you're getting paid for it. but that wasn't my purpose. I enjoy what I'm doing. Our navigators when we need to be, we are interpreters when we need to be. We are what the client needs, because what we want is help the client. And it doesn't matter what we have to do, but we are going to do it. Someone with degree can do the job, part of the job that we're doing. But when someone without a degree that is part of the community, they give the time, the passion to the community, that is something that no one can teach you, right? And that is part of the things that we are trying to people to understand and recognize that person. That person maybe doesn't have a degree, but have the passion, know the community, have the connection, knows how to approach the communities and help them. We need that part to be recognized.
Hi, I'm Kathy Wolfsfeld. I work with African American community out of the Calvary Baptist Church here in Salt Lake City, Utah. My focus mainly is on diabetes prevention, high blood pressure, and heart health. I was just a member of Calvary Baptist Church, and I was approached by my pastor, France Davis, and he asked me if I would be interested in being a wellness coach. And that included helping women, specifically African American women, through their journey of diabetes and high blood pressure and obesity. And so we made SMART goals, and we had a year-long program with each person and saw the improvements by leaps and bounds. And so that really wet my whistle to continue. And so I've been going to the health department to be certified in diabetes prevention program. I have been certified in correctly giving blood pressure and how to interpret the blood pressure numbers. And so I've just been awakened in this field. And I love people, and anything I can do to help someone, that's just my goal in life, my mission is to help. They are so grateful because they're intimidated by the white coat. They don't want to say anything that is not right in the doctor's eyes. They don't want to contradict. They don't even want to question him. They just want to think, okay, well, he's a doctor, I'll do what he says. But then they don't really understand what he's saying. So that's where I come in, is to try to bridge that gap between medical and patient. And they are so grateful because they actually can understand and they know that I'm telling them the truth. I have a real life for instance for you. I went to the doctor with my brother. He is in end-stage liver failure and has cancer. And his disease has progressed so that he doesn't remember things as well as he used to. And so I went in with my community health worker hat on so that I could explain to him what the doctor was actually saying. He was understanding things that were not even being said, so I saw that his disease was impeding his understanding of what was being told to him for treatments. And so I was there to reassure him and to break it down for him so that he could understand and he could retain what was said to him. COVID-19 has really shone a bright light on the disparities and on the underserved. The people that are underserved are at the bottom of the barrel. The health care that they have access to are usually last to get the PPEs. They're usually last when it comes to medical breakthroughs. They don't have the equipment. They're reusing disposable things, and you don't find that on the richer side of the aisle. And so just to bridge that gap, I'm so passionate about equal access to health care for all, because we're people. We are all human beings, and we deserve it. It is our right to be taken care of. As far as medical, we have the technology. We need to use it for everyone, not just those that have and not the have-nots.
I started, I want to say, very early in age, because it's just, the role is natural to like the mothers in our community. I'm a part of the Church of Jesus Christ of Latter-day Saints, and our Relief Society, they also do this type of work. And so growing up, we just did a lot of service, and people who needed, identified things they needed, we helped connect them to those resources. And slowly I started volunteering in the community doing that work, and it just came natural. And so I went into social work, in the field of social work, because it's very similar, and then got to use that degree to help me get back into community health and better help my community members. The most challenging part of this job in my community is providing information about resources that are available, but yet and then going through the whole process of qualifying people and connecting them to resources, only to find out that, if they're diagnosed with an illness like cancer or diabetes, there's not much we can do after they're connected to the resource. So it's challenging, because it's good to know that we can try to prevent others from getting it, but getting chronic disease. But for those who are already dealing with it and living with it, there's not much help financially to get the treatment that they need. Western culture is so very fast paced. And so, before, my grandmother would tell us about when she would see the doctor, and she would be able to talk with him and have time in the room. But because I've been in this profession for a while, especially in the healthcare setting, everything is, based on time. So quality metrics, they're measuring how fast you can get a patient in and out, because, the billing, of course, financially you have to be stable for your organization. But so a lot of our health professionals don't have that time anymore to spend and really get to know a patient and what their needs are, or what the root causes of their needs are. With community health workers, we have the time to, that's what we do. We sit down and spend that extra time to get to know what's the real causes of people's, non-compliance, as they say in the medical field. We're able to go out into the community where they're at, especially working with underserved communities. We know that we can't just sit in our offices and wait for them to come to us. Just because we have a service, it doesn't mean that people are going to come and jump and, take advantage of it. And so we are able to go out and do home visits, go out into the community, walk around, door to door, and let people know what services are available. And if we can, help them where they're at. Our community members are the ones who are suffering the most from this pandemic, because of, the inequities of health services and resources, and accessibility to these resources are really scarce for a lot of different reasons. Language, geographically, we're in the most rural areas. Resources aren't available right down the street like they are in other places. And so, we are facing that now. And we fought for so many years to say, hey, somebody needs to pay attention. There's a reason why, when we look at social determinants of health, there's a reason why these specific communities are suffering, and it took a pandemic for people to really open their eyes and see the real suffering of these communities. Because this pandemic has brought so much attention to the work that we do, that we're now sitting at the table discussing with other care teams, where do you want us? How do we fit in? What do you need us to do in our communities so that we can, reach the most vulnerable communities in Utah? And so I'm excited about that, because now we're having those conversations. People are paying attention really to who we are in a professional light. Throughout this whole CHW profession, I've learned that you always have to meet people where they are. And that's where the culture is here, I feel like, in Western culture. And everything is around health and social determinants of health. And if you look to the root causes of all of that, it comes from our trauma and our history and the experiences we went through of the racism. And I think the current systems have been set up from that as well. And so if we want to change anything, that's where we need to start.
Hello, my name is Ivana Holiday. I would first like to introduce myself in Navajo. Yat she Ivana Holiday insha. My desh gijnishle. The Bethlehem Bashichi ki ani dashiche. Do betatni dashinella. Like I said, my name is Ivana Holiday. I'm the Community Wellness Liaison at Salt Lake City Public Library. Part of my job is working with the community members within Salt Lake City, and I work in partnership with the Urban Indian Center. I also do a lot of outreach and community work in providing health services to community members. Being a community health worker is unique because you're able to work with community members face to face, and coming from a Native American perspective, you see and understand a lot of their struggles because you have family members or myself have gone through the same situations. And I think a huge part of being a community health worker is advocating for clients and patients, because you see them as part of your own and part of your own struggle too as well. I saw my grandparents struggle with diabetes and see them balance their glucose levels and receive dialysis. It was really emotional, and it took a lot out of my family, and also just not them understanding what is causing their diabetes. Then it kind of bridged off into understanding the effects of it within myself, and then the effects of it within my own siblings, like how it goes from generation to generation. It's a lot, and kind of it coming from that is more of like educating myself and educating my siblings, but then again also like going back into the community and educating them on health issues and the effects of their health decisions.
I've been working with the community for over 18 some more years now. Specifically, I'm originally from I am from the Liberian community. Originally, we founded the United Africans of Utah. I'm one of the founding father of the United Africans of Utah. This organization was put into place to deal with refugees, African refugees that were coming into Utah, being integrated into the Utah society, let alone coming into the great United States of America. People coming in as refugees that were born in the war, because there are several civil unrest in the African nations. So you have people coming from refugees camp that weren't even opportune to go to school to learn the English language, and then they got brought into an advanced society. You could imagine what that would be. So we quickly saw that as a way of forming an organization that would become the umbrella organization to service these communities, but also working with its respective community. Like, I'm from the Liberian community. The Liberian community has an organization called Liberians United in Utah. Okay, it is very unique, one of the advanced community in Utah that service its people, and we also service other people that comes to our community. It would be very, very helpful that health practitioner, understand the practical effects, not just the theoretical effects from school, but they need to understand one's culture, and they also, if they do not understand how to give treatment and stuff, they should be patient enough to have what you call interpreters, to interpret. That's where I believe community health worker comes in, from that specific community, saying that, okay, so within the culture, it is inappropriate for a male to treat a female, most especially in a different religion, not all religion except for that women to be touched or looked at a certain way, you know. So example like that. Sometimes they are rudely talked to, you know. Sometimes they are just given information that they do not understand, you know, so that they can figure it out on their own. You know, I feel like sometimes nurses and intake nurses do not have the patience to deal with that, you know. So at the end result, you will end up with community members coming from the hospital with frustration, you know, feeling that their needs are not met. And we hear about this all the time in the community. You know, either they're not understanding me, or when I speak English, they act like they don't understand me. It's very frustrating. And then also is that, hey, you know, I got this huge health bill, even though I went to seek help, but they are not aware of the financial resources, a system that they can receive. Yeah. You know, that's one thing that's hugely lacking of. So it is better for community health worker to work with their community members, you know, and with the community in educating the community.
Thank you, Tatiana, for sharing about the project that Dr. Lopez and you are working on with the University of Utah. We're always so glad to extend our you know, the work that we're doing with on all different platforms and with all different groups, so that we can spread more awareness about how you know, the collaborative efforts and partnerships are so important. And so we're so many of the CHWs that you have seen on this video, you will see today again presenting. You've probably seen them in other meetings at different conferences, but it's just so exciting to know that we're being able to share more and more with different communities, with different professionals, and be a part especially of this program. Tatiana, did you want to say anything more in closing?
Thank you so much. Yes, I wanted to praise this team. During our medical school orientation this year, their presentation, their time with the medical students was the highest rated session by all the students after 3 days of presentations. Imagine 3 days of Zoom. This was talking to the community health workers about their experiences, getting to know them, asking questions regarding COVID and their work in the community. Again, favorite session by all students. So it's been that in every venue we place this team. We just had their introduction to the physician assistant program. They had a chance to share and teach these students. Again, lots and lots of positive feedback. And so I am so grateful and so honored to have you as a team member. Thank you.